Thank you, Leslie. I appreciate the introduction. And I guess I'll give a bit of a disclaimer to say that the next 45 minutes or so are going to be a little bit different from some of our typical grand rounds, which are often, I think, maybe data heavy. And my presentation isn't entirely data free, but I guess I'll say that it's data light. My goal and my hope for you is that I can encourage you to have some hope for the future of sexual and reproductive health, and to give a bit of to place things in some historical perspective and to dream a bit about what things might be like in the future. We get some glimmers of hope for the future of sexual and reproductive health with the election last week in the state of Ohio, where I previously lived, and I'm really proud of the states and the citizens in the states that are standing up for abortion rights. I do have a couple of disclosures, but I hope you will conclude that they don't influence what I have to say. And I look at this talk this morning as my swan song. It's the last grand rounds that I will give for this department anyway. And checking with Wikipedia, since my son works for Wikipedia, it's one of my favorite reference points. But there have been references to a swan song since the 3rd century BC in ancient Greece. And it's a metaphorical phrase to refer to a final effort or performance given just before death or retirement. So I'm planning on retiring May 1. Death, I'm not so sure about, not anytime soon. So the phrase really refers to a swan song that is supposedly not very musical through most of its life, but in theory, the swan sings a beautiful song before its demise. So I hope I can metaphorically sing you a beautiful song this morning and give you some things to think about. I'm going to take you a bit in a time machine. And the movie, The Time Machine, came out in 1950. I'm going to start in 1952, which was the year of my birth, and I will spare you the math. I am 71 years old, and I wanted to highlight some events that to me have been really important events in my lifetime related to sexual and reproductive health, and have definitely represented progress. So in 1960, the FDA approved oral contraceptives. And this was after a period of development, but such a seminal development in my lifetime related to sexual and reproductive health, and has made a huge change for women and couples across the globe. There's not any other pharmaceutical that we call the pill. So the pill was approved in 1960s. And then the 1960s and 70s were really a time of changes and new movements, environmentalism. I remember the first Earth Day, and certainly that is something and a movement that we all need to get on board as we face climate catastrophes left and right. Feminism was a movement that was and is really important. I also remember the movement of ZPG, and most of you probably have no clue about what that stands for, but that was zero population growth. And that's not something we're talking so much about these days, but it was important in thinking about population at the time. In 1972, Title IX was approved, and Title IX states that no person in the United States shall, on the basis of sex, be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any education program or activity receiving federal financial assistance. So most of us know Title IX as being a sports-related law that had impact on high school and collegiate athletics. But I have to say, it really has been much more broad than that. But its impact on athletics was pretty profound. When I was in high school, there were no school-sponsored athletic programs for girls. So there wasn't a team that I could choose to participate in, and that is absolutely not the case these days. So it did relate and impact sports, but there were additional Supreme Court decisions in the 1980s and 90s that made it clear that sexual harassment and assault is a form of sex discrimination. And those sort of spin-offs from Title IX have been incredibly important to women. So that happened in 1972. In 1973, Roe v. Wade was passed, and we all know the impact of Roe v. Wade, but I think it's interesting to take a look at a map of abortion laws prior to Roe v. Wade. And what we see here really is the whole middle of the country. Abortion was only legal if there were a danger to a woman's life. And we know now, as we are facing new challenges related to abortion laws, that is not an easy thing to determine. At what point is a woman's life threatened? So this was the situation pre-Roe v. Wade. And then the situation after Roe was such that the whole country's laws were all allowing legal abortion. So incredibly important in sexual reproductive health. Another event in 1973 that I think many of us found important was the publication of the book, Our Bodies, Ourselves. And the subtitle of this book is a book by and for women. And this book really empowered us with knowledge about our anatomy and physiology and the power of women working together. So for me personally, this was an important book that came out in 1973 as I was starting medical school. I finished medical school in 1977 and finished my residency in 1981 and joined the faculty at the University of Virginia, where I was the first female member of the OBGYN department. If you can believe it, that was a case, and it was a different time and a different place. And our department today is different in so many respects compared to that department that I first joined in 1981. And it was at the University of Virginia that my colleagues in pediatrics really convinced me that girls and young women, adolescents, have a need for gynecologic care and that someone needs to provide that care. So those pediatricians really encouraged me in my start in pediatric and adolescent gynecology. As well, the formation of the North American Society for Pediatric and Adolescent Gynecology in the 1980s. Pretty important and formative to my professional career in finding a group of colleagues from around the country and around the world. So those were all steps forward. And unfortunately, as we all are well aware, there have been a number of steps backward, and I highlight just a couple of them. One of them that you may not be thinking much about, those of you who didn't live through the 70s and 80s, was the movement to pass a constitutional amendment, the Equal Rights Amendment. Disappointing to so many of us that amendment could not be passed. It is interesting that there is a movement now to bring back the Equal Rights Amendment and to try to pass it now, but I don't think it's going very quickly. So that was a disappointment. There have been a whole series of TRAP laws that have been passed, the targeted restrictions on abortion providers. These laws chipping away at Roe v. Wade and that legal right to abortion, culminating in the Dobbs decision, which overturned Roe v. Wade, that we all know so well and know the consequences so well. This is a map from Guttmacher that really shows the current status. And I had prepared this map given what the situation for things in April prior to giving this talk at the World Congress of Pediatric and Adolescent Gynecology. And it's changing on a daily or weekly basis, it seems. And so much of The middle of the country, again, has passed laws that are quite restrictive around abortion access. And so this is something that we are concerned about and dealing with on a regular basis. So certainly we've made some progress, the proverbial 2 steps forward, with at least 1 step back, but there are certainly some days when it seems to me as if we've gone 2 steps forward and at least 1.5 steps backward. So there's a lot for us to do, but I don't want us to get overwhelmed as we think about all that there is to do. I want us to think a little bit broadly and to start imagining how things could be better. I want to raise for you, and many, if not most of you, are aware of the group Sister Song. It was a group of African American women who, in 1994, really as an outgrowth and a part of the human rights framework, developed a vision for the future of what they termed reproductive justice. And I think that term is an important one, and we are rethinking how we think about sexual and reproductive health within that framework of reproductive justice. In 1994, Sister Song declared the human right to own our bodies and control our future, the human right to have children, the human right to not have children, and the human right to parent the children we have in safe and sustainable communities. In my opinion, the concept and framework of reproductive justice has been kind of slow to catch on. It's not a phrase that I hear very much outside of our own community in sexual and reproductive health and OBGYN. In the last presidential election, we heard progressive candidates talking about economic justice, something that we are very far from achieving. Racial justice, similarly, pretty far from achieving racial justice. We do talk and hear talk about environmental justice as our climate disasters get worse and the air that we breathe is worse and there are more and more fires in the state of California and elsewhere around the world. Social justice is something that we talk some about, and we talk about reform of the so-called criminal justice system as well. But I think that we're not hearing enough about reproductive justice, and that's a term that I think we should all be raising as a framework. So we've really moved from a framework of reproductive rights and abortion rights to the justice framework. And I think that one of the statements along the way that came from the World Conference on Women in Beijing in 1995 was the statement from Hillary Rodham Clinton, who stated, "Human rights are women's rights, and women's rights are human rights as well." And this reframing, I think, is important because the rhetoric of choice doesn't really acknowledge the context in which many women had felt that they did not have a choice. And that particularly applies to women of color and Native women. And so the framework of reproductive rights is one that I think is very important. I've spoken about things occurring nationally, but internationally and globally, the United Nations has developed an agenda for sustainable development with the target of the year 2030. And within those targeted goals, there are 17 targeted goals from the UN. There are 3 that are related to sexual and reproductive health. Goal number 3, to ensure healthy lives and promote well-being for all at all ages. Goal number 4, to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. and goal number 5, to achieve gender equality and empower all women and girls. So these are some of our goals for 2030. As we think about the strategies to achieve those goals, it was only in 2015 that the UN added adolescence to talk about women and children. So prior to 2015, the phrase that we were focusing on health and well-being for women and children. And in 2015, this publication came out, A Global Strategy for Women's, Children's, and Adolescents' Health. And I remember being at the 2015 meeting of the Society for Adolescent Health and Medicine. And there was a lot of excitement about this decision to include adolescents. And of course, that decision acknowledges the unique challenges that face young people. Those of us who take care of adolescents on a daily basis certainly recognize those challenges. Those of you who have adolescents as children recognize those challenges that children and adolescents and young adults face in today's world, and they recognize those challenges as well. But it's interesting that this move from the UN acknowledges adolescents' pivotal role as key drivers of change. And so adolescents, of course, are our future. Our children and grandchildren are the future. But you need only to Google young women who are changing the world, and you will read about a lot of young women, adolescents, Greta Thunberg, Malala Yousafzai, that these are two of the very, very well-known individuals who are young and are their messages are getting out to the world. So we need to listen to them. Again, as part of the global strategy for women's, children's, and adolescent health, we have the strategies to ensure universal access to sexual and reproductive health care services. And they state explicitly, including family planning and rights, and eliminating all harmful practices and all discrimination and violence against women and girls. Seems like it makes a lot of sense to me, but I'm not sure how far we are in achieving those goals by 2030. This is an interesting publication, and of course you can't really read what all it says, but this is a publication, again, that came from Guttmacher that really operationalizes and puts some measurements to the Sustainable Development Goals, measures of progress as we work toward those goals of the future. I'm going to switch gears just a little bit, and I'm going to be channeling Professor Minerva McGonigal with her crystal ball. And coming from Hogwarts, I'm going to see if I can look into my crystal ball and think a little bit about the future. When I talk to patients, and patients sometimes ask me, well, when is my first period going to start, for example, or something else that they anticipate in the future, I often say, I wish I had a crystal ball. Someone gifted me one, but I think it's fake. It doesn't really work the way I'd like it to work for the future. But as I look into that crystal ball, I'm going to ask you to dream a bit with me. And I realized before I prepared this talk that on a day-to-day basis, I was really focusing on the challenges at hand. So many of us really focus on our own little area of expertise. And for many, many years, I was focused on adolescent contraception. And in fact, when people would ask me, what is pediatric and adolescent gynecology, I would say that it was preventive obstetrics. So I was very focused on adolescent contraception. And I didn't really let myself think about what life would be like if and when our work really has progressed to the point where the goals that all of us have in working on our own little subspecialty areas of sexual and reproductive health, what it would be like if all of those goals came true. And so I'm going to ask you to imagine a bit, to imagine a world in the future. And I don't know, are you able to hear that we can imagine?
Yes.
So let's imagine a bit. So I'm going to be listing a number of things that I hope to see in my crystal ball if it ever starts working, and thinking first of all globally in the sphere of education. So in my vision of the future, all schools would provide age-appropriate, comprehensive sexuality education. This is something that I have been thinking about and working toward for many years, but has once again become somewhat controversial. And so you can look at advocacy statements that will be published soon or that are on the website from NASPAG and from the International Pediatric and Adolescent GYN Society that support strongly, as does the UN, comprehensive sexuality education for all at an age-appropriate level, really starting very early in the school systems. In my future, I would like to see universal access to reproductive health and reproductive justice as well. In the sphere of gender equality, respect for women's sexual autonomy would be assumed. Imagine that world for a moment. A world in which sexual harassment and assault have been eliminated. In the sphere of health, all individuals would have access to basic knowledge about sexual and reproductive health and knowledge about their rights as well. And sexual and reproductive health care services would be universally available to all and would be included in national policies. Putting on my hat as a PAG clinician, thinking about adolescents and young adults, there are a number of other things that I see in my crystal ball. Every child would be a wanted and planned child. We all know that currently not all pregnancies are planned and not all pregnancies in children are wanted children. In the vision of my future, we would see prenatal and postpartum care universally available. They are not currently, or at least not affordable for all individuals. Female genital mutilation or cutting will have been eliminated. The UN estimates that approximately 3 million women annually are at risk for female genital mutilation in Africa in particular. And so this is a big issue for women internationally. Adolescent births in the future are infrequent, and all of those pregnancies are planned. As we think about where we are now related to adolescent births, we see that we have made some progress. This is over time, and in all parts of the globe, there has been progress in eliminating and lowering adolescent birth rates. But if we compare among and between developed countries, these are rates from around 2011, we see that the United States is really head and shoulders above or behind all of these other developed countries in terms of rates of adolescent pregnancy. And while those rates have declined since 2011, we are still not where we need to be with regard to adolescent pregnancies. So back to the future, some specific pediatric and adolescent gynecology aspirations. So if there were a question when a baby is born of ambiguous genitalia and a question of differences of sex development, there would be a multidisciplinary team available or close by for consultation and helping parents address the issues that are important around DSDs. We have such at Stanford, but there are many, many, many places, certainly around the US and around the globe, where this is not available. Mullerian anomalies, one of the complexities that we deal with in PEG, would be in the future recognized early and appropriately managed. And just a brief public service announcement for those of you who care for pregnant women and do prenatal ultrasounds. When you see a renal anomaly in a fetus, and that's clearly a big deal for that fetus, and it's not difficult to see and is reported on anatomy scans. If you have a fetus that has a renal agenesis or dysgenesis, those infants are at risk for Mullerian anomalies, and the risk is not terribly well established, but probably around 30+% of those individuals with renal anomalies will also have Mullerian anomalies, and those Mullerian anomalies can be structural anomalies that impact fertility. So in the future, those would be recognized. Those parents who have a fetus with a renal anomaly need to know that as their female child matures, they would need to pay attention and potentially screen for Mullerian anomalies. Another of my pet peeves is related to the terms that individuals use to describe genital anatomy. So in my vision of the future, all kids would learn anatomically correct terms. We wouldn't talk about the JJs or other made-up words that people say because they can't say the word vagina. We've mentioned the universal age-appropriate comprehensive sexuality education in all schools. Other aspects of my future vision: HPV vaccines would be universally available and everyone is vaccinated so that we can virtually eliminate cervical cancer. Other vaccines against other infectious diseases, including HIV, would be eliminated in the future. Currently, as we think about STIs, we know that adolescents and young adults have the highest rates of chlamydia and gonorrhea. Those rates for chlamydia have been increasing. They declined a bit and then they increased again during the pandemic. Rates of gonorrhea have been up and down and are again on the upswing. And tragically, syphilis is on the upswing. The CDC just last week noted that congenital syphilis is again an issue, and raising that issue, we need to screen again for syphilis. So in the vision of the future, these STIs would have been eliminated. Some other things that I see in my crystal ball: it would be my hope that all primary care clinicians would be well-trained in what is within the range of normal. So as we think about menstruation and puberty and menarche and adolescent growth and development, it would be rare to have a teen see her primary clinician, the teen who's been bleeding for the last 30 days, and be told, "We see irregular periods among adolescents." Well, no, we don't see. It is not normal to have bleeding for the last 30 days. And we see those girls referred all the time to us today. But in the future, that's not going to happen because people would know what's normal. Adolescent-friendly care would also be the norm. So what is adolescent-friendly care? Well, it applies for women of all ages, but particularly for young women. It would be accessible, it would have an accessible location, and the hours would be friendly, and the costs would be friendly. Confidentiality is particularly important to some adolescents, and that would be guaranteed to adolescents. And same-day services for LARCs and STI screening and mental health services would be available. Again, important for individuals of all ages, but particularly important for adolescents. In the future, menstruation will be handled with dignity, and period poverty has been eliminated. So period poverty, the inability to access catamenial products, pads, and such, as well as the ability to continue to attend school during menstrual period, is a real issue internationally, but it's actually an issue in the United States as well. My view of the future includes everyone tracking their periods and aware of the relationship between menstrual cycles and health and disease. The concept that the menstrual cycle is a vital sign that we need to pay attention to in the same way that we pay attention to blood pressure and pulse and respiratory rate. If you're not having your menstrual cycles and you're not taking hormonal medications to suppress them, then your body is trying to tell you something, and we need to listen and pay attention. The next item is one that seems pretty minor in the grand scheme of things, but in my view of the future, everyone would be aware that non-steroidal anti-inflammatory drugs help dysmenorrhea. Dysmenorrhea, pain with menstrual periods, is a huge issue. Up to 90% of adolescents experience dysmenorrhea, and a significant proportion of those experience severe dysmenorrhea and miss school on a monthly basis. And yet, people don't know that naproxen and ibuprofen are helpful and much more helpful than acetaminophen for dysmenorrhea. It's certainly the case that the vast majority of patients that I see have taken either Pamprin or Midol. And one day I want to meet their marketing people because they've done a fabulous job in convincing people that they help dysmenorrhea, when in fact, if you look at the various formulations of those two products, they don't contain any substances that have been shown to be helpful for dysmenorrhea. So primary care doctors would also know that NSAIDs help dysmenorrhea, and if they have patients whose dysmenorrhea is unresponsive to those NSAIDs, they would refer them and consider the possibility of endometriosis, which would be diagnosed early, new methods of diagnosis, and would be managed appropriately. In addition, a huge issue for individuals of all ages, but particularly for adolescents, is mental health. And in my view of the future, all clinicians would be well trained to screen and refer individuals, especially adolescents and young adults, for mental health issues. But screening isn't really enough. In the future, mental health services would be easily available and would be accessible to everyone. In the future, sexuality is recognized and normalized as part of being human. And I think most of us are familiar with the gingerbread person and the differences between biological sex and gender expression and gender identity, sexual attraction and romantic attraction. So in the future, this will be well recognized and respected. There will be a focus on consensual and safe sexual activities with effective contraception. Again, that's something that we can hope for. Modern effective birth control methods will be available. So what are modern methods? So this is data and information from the UN, again, internationally, on the availability for adolescents of modern contraceptive methods. And I thought initially, as I started thinking about this, that those modern methods would be hormonal methods and LARCs, but modern methods really include barrier methods and lactational amenorrhea, emergency contraception, those options that are somewhat more available for adults, but often not available for adolescents. So those modern methods will be available for all. And in addition, we'll have gone a little bit further toward developing the perfect method of contraception. Of course, that's not going to be just one method, and there's no one size fits all, but the duration of action of the perfect contraceptives will be as you like it, and you can choose. They'll be 100% effective. They'll be easy to continue and use successfully. They'll be safe without significant side effects. They may have non-contraceptive benefits. They won't cost very much. They'll be preventive of STIs. They'll have a predictable impact on the menstrual cycle, and they will fit with your life, and you and your partner will view these methods positively. So these are characteristics of contraceptives, the perfect contraceptive, that we are not yet there, but we're on the way. Some bigger issues: child marriage, still an issue around the globe. In the future, abortion will be rare because we have perfect birth control, but it will be recognized as integral to health care. And unsafe abortions will have been eliminated. It's been estimated that 25 million unsafe abortions occurred each year between the years 2010 and 2014. And unsafe abortions are still occurring around the globe. Some other thoughts about my future as I dream on, not just as a PEG provider, but as an OBGYN clinician. We'll have a better understanding of the pathophysiology of gynecologic conditions, including heavy menstrual bleeding leading to anemia in 1 out of 4 girls and women, 1 out of 4 females internationally. PCOS also well understood with early diagnosis and management, preventing anemia and preserving fertility. In my hopes for the future, the societal messages will include body positivity for all shapes and sizes. Obesity and eating disorders will be better understood and screened for and managed in a holistic and multidisciplinary manner. Social media platforms will contain safeguards for young adolescent users, as well as accurate public health messages, while eliminating fake news. And lastly, surgeons will all be dedicated to saving ovaries, including those that are torsed. So these are just a few of my views of the future. I'd encourage you to take a look at the advocacy statements that I mentioned from NASPAG and the international organizations. I'll remind us to keep a reproductive justice framework as we think about and dream about the future.